on behalf of our teams here. So, and on behalf of Homeopathy. So, I welcome Dr. Shailesh and we can start the session now.
Thank you, Dr. Lipin. So, today's session is viral link to the cancer. So, very important thing is we usually say in terms of cancer, everybody knows what traditional framework says. It says genetic, environmental, lifestyle, and immune function. But an equally powerful variable which has been historically under recognized, the persistent viral footprints. Now that is what is why it is important today. Viruses don't only just cause an acute infection, because we usually see allergic cold, cough, or fever. We usually say it's a allergic or it's a viral. But if virus is going to enter into the host genome, that shape immune responses, alter cell signaling, along with it create a long-term biological imprint that influence disease, explains years or disease later as well. This viral footprints is not merely theoretical model today, because high throughout the sequencing and molecular diagnostics and oncoviral research, we can actually map these viral traces within the tissue. Understanding of this footprint is critical because it offers unifying thread connecting infection, biology, chronic inflammation, even immune dysregulation and cancer development. Now, if we talk about the link between the virus and chronic disease evolution, see, we are going in the next 5-7 minutes we are going to start the at actual cases. But why we need to understand, because if we are not able to get how this approach is coming up, then that will be more helpful us to understand how we are looking into it, right? So now the link between virus and chronic evolution is, globally we now recognize the chronic disease once, though to the purely degenerative, maybe we have the infectious triggers or cofactors. For example, if we see the EBV, EBV is Epstein-Barr virus, which is found in multiple sclerosis. ME or CFS is autoimmune thyroiditis. Hepatitis virus links with the metabolic derangement. HPV in the oropharyngeal cancers, and herpes virus, which is influencing vascular inflammation. Now here we can understand how the viruses are there which are causing the chronic diseases. Now if we see the mechanism, which is not direct viral infection alone, but virus modulate the host immunity. They create persistent low-grade inflammation, epigenetic changes, bystander injuries, molecular mimicries, and cytokinin signaling. Means these viral conditions emerge when viral latency intersect with the modern lifestyle factors like poor sleep, insulin resistance, microbe shifts, and reactivation. As a clinician, we need to recognize the viral terrain, which helps to understand step beyond the symptom central diagnosis towards understanding the patient's long-term biological history. So this is what in the virus. Now if we look about the modern cancer epidemics and the hidden viral role, cancer epidemiology is drastically changed. How? Because we have seen nowadays the cancer is found in young age group, more aggressive subtypes as well. And if we look at about the 15 to 20% of all human cancers have direct viral etiology, while even larger percentage have the viral cofactors like HPV, HBV, HCV, EBV, HTLV, and even the MCV as well. So this inflammation, genomic integration, oncoprotein expression, and immune evasions. So this is how viruses are actually playing a big role. But what has happened today is, many times whenever we visit a physician, usually they say we don't know the cause. But if we look it into the depth, we get to know how the viruses are playing the role into developing the cancer in the body, and which are converting into the metastatic stage at the time progresses. Now if we see by the impact by the 2000, that 15 to 20% of the cancer cases are caused by the itself only virus. So this is what is the global condition. Even though the HPV vaccination, HBV vaccination, these all antiviral treatment for the hepatitis C, global screening policies already began to reduce the cancer burden in many countries. But still, if we look, the virus may not be there in the body, but it have ability to produce a cancer which is called as a scar. Means it's not necessary that virus need to be there at the moment whenever the person is going to get detected with the cancer. That's quite possible that already got an viral infection that left the body, and now that is showing the his latent phase into the body, and which is showing in terms of cancer growth. So now major oncogenic viruses, as we explained, HPV, EBV, HBV, HCV, HTLV1, even though HH8, but these all are having ability to produce, like HPV 16 by 18 switch off the P53RB, which EBV derives the B cell proliferation. Now HBV, HCV create the chronic liver injury, even though like HTLV directly transfer the T cells, while HH8 drive the vascular tumor, like Kaposi sarcoma. But this key point is virus alone doesn't cause the cancer. See, this is very important. Virus doesn't cause itself, is not only cause, it is a one of the cause. Now, how it important? Because it need a susceptible host, means the body is weaker at the vital force, means it is in the susceptible host, like it is the host is getting weaker, and that causes the chronic inflammation which alter the terrain, and most infected people never develop a cancer, but which are the terrain, immunity, genetics, microbiome, lifestyle, these all the parameters decide to develop a chronic disease or cancer. So DNA virus, which are like HPV, ABV, herpes, are long term in latency. What it means? It means they are there in the body for longer time, but they are into the sleeping phase, or they are called as a latent phase. They are not in active phase. As the deep tendency parallel with the psychotic and latent miasmatic sphere, RNA behave differently. They are very fast moving, rapidly mutating, but more disruptive similarly to the syphilitic pattern. These metaphors, but they help map homeopathic idea into the virological behavior. Now very important is what is truly matters, that is a terrain. A weakened vital force, stress, poor immunity, metabolic imbalance, these are actually viruses persist or flare up. The similibum doesn't kill virus. Very important is most of the time whenever we talk, we usually ask, okay, doctor, whenever we take the homeopathy, are we killing the cancer virus? No, it's not. Because it restores the regulatory balance, it acts like a dynamic reset, improving immune tone, reducing susceptibility, and stabilizing the terrain. So viral expression itself decline naturally. So here we need to understand how homeopathy works. Like in modern science, people usually get the injectable and they say the viral load is getting down, or the tablet they give. But in homeopathic science, what we look, we give the medicine to restore the regulatory balance which is already disturbed into that patient. Like, which is called as in the our homeopathy, it is called as a dynamic reset, improving vital force, reducing susceptibility, and stabilizing a terrain so that viral expression declines itself naturally. This is how by homeopathy we treat. Now let's focus with the first case, hepatocellular carcinoma. Hope doctors are there with me, right? So now the first case of presentation, today's presentation is hepatocellular carcinoma. A patient, I definitely remember this case because the patient came to me. He told me, doctor, even now I'm not a chronic drinker, and since last more than 15 years I have not taken a sip, but still doctor, I have a hepatocellular carcinoma. That was his astonishing face, was saying ki even though if I am not having the alcohol, or if not I am taking any other medicine or anything which may have ability to cause the hepatocellular carcinoma. Then he asked me, then why me? See, what happens is, now we usually say patient is alcoholic and that patient that is causing the cirrhosis, and as the time progresses it converts into the hepatocellular carcinoma or any other carcinoma. But this case is why interesting, because his history, his habits and his lifestyle and the the profession he is into. So whenever he comes to me, what he said, ki how am I getting this? But what happens is, many times this kind of patient is going to the physician what they says, we don't know what's the cause, but yes, now that has been the finding into the reports and that biopsy, let's treat it. But they have right to understand, I'm just given my efforts to give what I have got an experience while looking these all cases. So that patients whenever comes, as we know, we take the proper history because it is very important for the record keeping and to know how the things are progressing. As the case, the patient says, doctor, I have lost my appetite, and like more than 1.5 months I am not feeling to have food, even though I feel my stomach is heavy, and because of that now I have lost my 4 to 5 kgs. Then I asked him, ki, how about other things and all? Then he said, like the patient usually have the symptoms. Simply, the patient is not able to have food, already lost a weight. By default, the patient is having the tiredness, slight jaundice-like look, dark in urine, and low-grade fever in the evening. Now, as the time I asked, ki, what's the do you have what's the past history of yours? Then he told he was going for the insurance checkup. There he got to know ki he has a HBsAg positive, that is hepatitis B positive. Okay, then next, then he told me ki in 2015 to 2020 I got the monsoon fever, and there I get to know my EBV IgG got positive, which was maybe that is the latent infection. He got a dengue in 2017 as well, and in 2021 that patient got hospitalized for the post-COVID weakness for 3 months. Now here, what is our learning about this history and this case? This is what is called as a dynamic imprint. What is dynamic imprint? That is identical to our master concept of miasmatic memory, like disease information persistent long after the cause is gone. What I mean is, as I said earlier, hepatitis B was got diagnosed before, okay, in the 2008. In 2015 to 2020, he got diagnosed with the IgG positive, even though dengue. Even though in 2021 he suffered with the COVID as well. Now, if we connect these all dots, where we get to know that this all showing impact on his case. So, how the past history is important. But most of the time what I found is, doctor usually ask typhoid, malaria or dengue, that kind of history we usually look at into. But from my experience, I just would like to say, we supposed to ask the viral history as well, because viral history is always very important to understand that scenario, like from how it enters and how it become today is. So here is the condition. Now, if we move on the family history, here we get the cirrhosis of liver due to alcohol. His father had, mother diabetic, his elder brother died because of stomach cancer. Now, if we see now, his personal history is quite interesting. Like, patient is non-smoker, even though occasionally alcoholic, which was there in his youth, means last 2008 from, he is not even taking it. Now, lifestyle is better, sedentary, stress is financial as usual. Usually the patients or many of the peoples have, sleep got disturbed. Now physically, when we examine that patient, we get to know the person is looking tired, thin, mild tears, and the patient was saying ki here I am in the right hypochondrium, I am feeling bit heavy. So we checked, then we get to know the tenderness, and even the liver is also palpable and mild ascites. So as we always follow the protocol, here we get to know all the tests done. There we get to know about the bilirubin is got quite high, that is 2.4, SGPT 145, SGPT 145, SGOT 170, ALP is 410, and AFP marker, that is a tumor marker, which was 480, was in very high. Then in sonography we get to know that liver is by default enlarged, 3.8 into 3.2 centimeter lesion was there with the right lobe, which was a suspicious for HCC. Now after that all the stuff, we ask him to go for the MR. Then we get to know he is having segment 6, like a typical of the hepatocellular carcinoma. As we know that we did that all the markers like HBsAg, because he told that in 2008 he suffered with the HBsAg, so we need to check it again. So we got to check with the HBsAg, HCV and EBV IgG. Here we got HBsAg got positive and EBV IgG got positive. Just wanted to say something about the EBV IgG. Most of the doctors, what they'll understand about the IgG concept, and what is my understanding, I would like to explain something. See, if the EBV is absent, then IgG and IgM will be negative. But in the case whenever the EBV IgG is positive but the viral load is negative, means that viral already impacted to that individual. Now that virus is gone out from the body, but it already changed the terrain, or epigenetic shift is already there with that patient. This is what is all scientific. If you Google it, you will also get to know what I am actually trying to explain is. Now, here is a clear evidence that living terrain is still harbors and dormant viruses, and which cause chronic inflammation, which is actually called as a carcinogenesis. So, what the evidence itself explain, that even after recovery, like internal terrain can continue to harbor dormant viruses in the body. Means HBV already he took the medicine for it. His viral load may be the down, but that terrain is still continue in dormant phase in the body, which actually cause the chronic inflammation, and which is an well established driver of the carcinogenesis. It disrupt cellular repair, increase in the body oxidative stress, create a pro-cancerous environment over the years, and now if you see, it has already modified his terrain, reducing inflammation, supportive immunity, and restoring balance is essential for the long-term disease prevention. Means how homeopathy need to correlate with this all. This is I am just trying to explain, because what happens is now most of the time we see the cases, but what we ask is, doctor, which kind of medicine you give? Why this medicine is given? But I always say need to understand a case first, then and then only we can, go with the step by step with the each and every level, and so that we can able to understand whether the things are going on right track or not. Because most of the time patient is feeling well, we are saying all right, but no, it's not like that. Because in pathological way, in physiological way, in his mental way, on his physical plane, mental plane, he need to look, and we need to understand how he is changing. That is why this is very important. Now the case of diagnosis, if we look at about it's a primary hepatocellular carcinoma. So viral trigger already terrain deterioration, means how, like HBV plus EBV latent load, which caused the case which is called as a chronic inflammatory state. So this is, hope you guys are getting how I have reached and how I have calculated. Now let's move. Like viral terrain shows like immune weakening, chronic inflammation, ideal environment for the hepatic mutation. Like how HBV entered, EBV entered. It altered the whole terrain, like immune system, like T cells, B cells, they got impacted in the body. That is why silently that inflammation process started going into the body, and that old chronic latent infection of HBV, EBV associated with the dengue, that all today's outcome is that patient landed into the hepatocellular carcinoma. See, this is what is my judgment, what I have drawn from these all cases. Now, how it helps as this time and the case progresses, you guys also get to know how I have seen in that case. So, here is a miasmatic approach. In SORA, like weak digestion, poor immunity, anxiety, and disturbed sleep. Now, as I said, the poor immunity, why? Means that HBV and EBV affected his immune system, which caused the poor immunity. Because after that, the liver started getting weak, which caused the weak digestion. By default, once it is been developed and it started affecting his quality of life, which actually developed anxiety and disturbed sleep. Now this is a soric phase. If the patient is entering and if we are seeing, we can able to see this the soric phase symptom. But as we entered in the case, we get to know how it is going towards psychosyphilitic phase. Like on the report and on physical examination, like liver enlargement, viral persistent chronic inflammation. In syphilitic phase, tissue destruction, cancer pathology, and hepatocyte mutation. So here is a final conclusion comes up like cancer diathesis, psychosyphilitic case. So dynamic interpretation, what it says? It says physical tumor is the final visible expression of long-standing dynamic disorder. What we call as in our homeopathic science is chronic miasmatic culmination. Means the disease started from somewhere, landing into the some other parts which absolutely affect his expression, like the converted physical tumor, and which is a visible expression, means that we can able to see. That is called as a chronic miasmatic culmination. Now this is the what the totality we drawn from the case as like chronic viral history, hepatic pain and weakness, weight loss, jaundice tendency, as we have seen that SGPT, SGOT, even the bilirubin got impacted. By default, that is an accessory symptom like fear of death, because if we see any cancer case, what is the in general tendency of the people? They have the fear of death. Family history of GI cancer, which is really important. How it is important, I'll explain. Now, liver tumor, MRI already confirmed, and high AFP. This is what is our totality. Now, if we see the prescription plan, see here I would like to give some knowledge how we give the treatment protocol. We usually bifurcate the treatment plan like three phases. One is constitutional remedy, another is miasmatic remedy or the intercurrent level, constitutional level, miasmatic or intercurrent level, and the third level is organ supportive level. So how it goes, that I'll explain. Like here in this case we chosen carcinosin. Now here 204 pills one dose weekly for 4 weeks. Why we chosen carcinosin is really important. First of all, cancer family history. Second, patient is so perfectionist and sensitive in nature, that is he started thinking what will happen to my kid, how will be my future, my age is not that much, how I am going to survive, whether if I am going to survive or not, because my already elder brother is died because of that, my father already had that stomach cancer history, I am quite worried and all. So here that sensitivity we judge. And in chronic viral load, that is a psychosyphilitic diathesis, sleeplessness more profoundly in 1 to 3 am, and blue sclera, that helps us to choose this medicine. Now, very important is, doctors, detection is a knowledge, but correction needs a dynamic healing. How it is? This is what is our domain, being homeopath. Like modern diagnostics, what they can do, they can identify what is wrong, but the true correction required understanding living terrain, means what, how the process is going on. If we understand the process, then and then only we can able to give that justification positive to that patient. Like our hearing loss is, if we need to treat, we the first symptom will today's symptom will go at last and first symptom will go first. But if we don't know the whole case scenario from where it been started and where it got ended, then that justification, that for that we need that knowledge, and that correction dynamic healing is important. Like vital force, like pattern beneath the disease and the vital force that drives the recovery. Anyone can detect the pathology, but the only dynamic individualized healing relying to the internal imbalance restoring order and transformation of susceptibility. Our role being homeopathy, not to just to label the disease, but to guide the patient vitality back to the harmony. That is what the essence of holistic medicine. This is what I think. Now, then as I said, first constitutional, now second is organ remedy. Here we chosen chelidonium. We usually give dose 15 drops, and liver, why it is given? It's a right sided liver specific action, and the indigestion plus jaundice tendency was there, so this drug was chosen. Antiviral nosode, as we have the clear cut history like hepatitis B, so here we give that hepatitis B nosode 34 pills twice weekly, because we know that disease has that kind of origin from there, so we gave to correction of terrain, that is a hepatitis B 30, and that is also important for reduce the residual viral burden as well. Now here again intercurrent remedy, Thuja 1m 1 dose after 2 weeks. As I said, we need to understand every level. Like in modern science, how they do. This is a chemotherapy tablet. This is a multivitamin tablet. This is for if there is a pain. If you don't feel hungry, this is a tonic. Likewise, we also need to plan our treatment properly, or else that patient quality of life, once it is not going well, the patient may skip the treatment. So here, for his betterment of health, and our protocol also need to be as per the need of that case. So here the Thuja 1m is given as a chronic viral background and psychotic miasm and to open a layer. So here we use supportive tissue salts like natrum sulf, kalimur and calcarea fluor 6x. Natrum sulf for the liver drainage, kalimur 6x for the purpose of inflammation, calcarea fluor 6x for the tissue repair. See, why I'm explaining you all that, only medicine is given is not important. You also know, doctors, these are the medicines for that. But you also need to understand what is our understanding to give in this case. So this is what I'm just trying to explain you guys. Now, the tissue salts is 4 pills BD. Even though what happens is, patient usually asks us, doctor, what diet and lifestyle I supposed to follow? Here, I never say to my any patient, don't have this. I usually use a word, what you will do now, will suggest the diet, you just have that. So don't give the negative thoughts to anything. First thing. Second thing, our protocol is standard. Eat before sunset for each and every case. Why? I'll tell you. Already the sunset is already happened. Now trees already started taking oxygen, and now they started generating carbon dioxide. To digest the food need plenty of time if after having the food after sunset, and that actually increase the acidic body, which caused the body become acidic and pH got up, which actually affect the whole system, and that is a very crucial environment to develop this kind of disease progression. So better, we usually say, eat before sunset is a one thing, twice a day meal, second thing. Third thing, have half kg of fruit per day, half kg of salad per day, whichever available at your place. Green vegetable soup and jwari, bajri, nachni, rotli, crush and eat. Milk and coconut water. Why this is important? If we make the body, see, whenever the human being take a birth, they are in alkaline phase, right? As the time progresses and changes and system is going to change and food is entering into the body, that becomes started getting acidic. Here we need to again came back to the normal to the body. For that we need to give this kind of diet. Along with that, plant-based diet, haldi, black pepper water, stop all processed food, 30 minutes walk daily, sleep by 10 p.m., sunlight exposure. This is what we suggest. Now guys, very important thing is we are talking about the cancer cases. So it's not like that we are talking about the loose motion or abdominal pain. So if we are not going to see the how the case improve, at least we need the follow-up 10 session to get the clear understanding. Hope up till now, no doubts. Anybody?
Anyone has doubt, just raise your hand or just type your questions in the chat box. I will let you, I will unmute you, and based on that, we can go ahead with the session. So if you have any doubt, just let us know. So one of the question is that could you explain the diet again so that some people didn't get it well.
Okay. See, what I'll do now, at last now, I'll give the proper thought in very detail because diet is really important. And how to take and how to explain, I'll give in a very proper manner. Don't worry. Okay. Or else if you wish, I can give right away. Now the question is arise, let me clear this doubt first. Very important thing, ask patient to have the 2 meals per day. Second thing, ask them to finish the food like main food, like meal, like before 5:30 or 6. Like how I told the patient, I always ask, don't have the breakfast. At 10:30 have the lunch. At 5:30 have the dinner. Once you wake up in the morning, don't start your day with the milk or tea. Start your day with the fruits. In the afternoon, if you feel hungry, have the salad. Now, how much quantity they can have? They need to finish every day half kg fruit and half kg salad with very positive and the broad smile on, keeping broad smile on face, because that we are giving them for to make them alkaline. If they are in the, there will be in the stress, it will become again acidic. Last important thing, they'll ask you, doctor, if I'm not going to have food at after 8 o'clock and 9 o'clock, I can't sleep. Then there you need to explain, food is for energy, energy is for work. After work, your body will get exhausted and then you need a rest, which called as a sleep. So if you have the food at 9 o'clock, it won't help you to get digested, and it is going to increase your condition, or it will affect your acid based balance of the body. So better have the food at 5:30. And very important thing, what are the indications to be given in the diet? What we usually do now, we give the 3-page diet. I'll tell you by my own experience, nobody likes to be there in control. So here what is to be given? Here you need to tell them 5 things which I usually tell to my all patients. 1. Half kg fruit, half kg salad per day. Coconut water twice a day. 1 glass of milk or half glass of milk if they like to have before bed. Green vegetable soups, whichever, but it should not be added with that adulteration and all that stuff. Basic homemade soup with jwari, bajri, nachni, rotli. Means here I am saying don't use the wheat, because that gluten is going to cause the issue to the body. But here if we says na कि don't use the wheat, then patient will start talking on that wheat. So better don't tell that. Only you need to say this 5 foods you need to add, have the meal twice a day, eat before sunset. That's it. If you wish, then patient will, maybe you will ask, कि doctor, if I feel hungry at night, what I supposed to do? Here you need to tell them you can have the green vegetable soup, fruit, salad or milk. Then again patient will ask you, doctor, some people says should not eat the fruit after sunset. Then you also need to know that is what the people are, they can have the pav bhaji, Chinese and the dosas and the coffee and the ice cream, that is also not written somewhere to have it, but people still have it. But that is all acidic stuff. What we are talking is about the alkaline stuff. See, don't try to find out a very huge diet for each and every person. That is not, nobody is going to follow. That is what my experience in the last 15 years. Hope this doubt is clear. So let's proceed ahead with the follow-ups. Now, at the very first follow-up, once we gave that medication, patient's appetite got better, patient pain got reduced, and patient's sleep is also improved. Patient says, doctor, feeling bit energetic now. Now, that is what is called as a present observation after looking at him, and that is what given by that patient. Now we need to see but through the investigation as well, because world wants everything in proof, so better also go through with it. So we checked about the LFTs. Here we get to know that 3.2 comes to 1.8, SGOT like 150, 140, that comes to 130, SGPT comes to 110, that AFB was like 480, which comes to 420. So here we get to know, see, many time what happens now, as we the patient says homeopathy is slow now, it will take time to act, but that's not true. If it is going to act, it will show the action and it will be there with that patient, even though that will be there with the report. Why it is important to do the reports? Because we need to understand whether the track which is been chosen, which is right or wrong. Or else many time what happens is, we are given medicine, patient is taking for 6 months, and then we check after 6 months, then we get to know this is the something is not right. Then unnecessarily to take a risk for anybody's life is not okay. So better to take care. Even though in the modern science they also do the same, na? They always check the CBC, they always check the LFTs. Then why we should not? Then we also need to do. So now, as an assessment, if we look now, it's a good initial response plan. So what we did now, we keep continue the same. But here we added one thing, that is borax Q. If you see in Rickvig list, you will get borax Q, which what is important of it? That is reduce the hepatic loading and improve biliary drainage. If that biliary drainage is okay, na, the by default the digestive system will get toned up. And once it has been toned up, now the body will start getting increasing energy level, right? So, and it is very important to reduce the toxic accumulation and from the tumor metabolism and liver cirrhosis. So it is not going to help only to reduce drainage. It is going to help the tone up of that organ specifically. As even though the carcinosin we keep continue 200 4 pills once weekly. Now in second follow-up, patient is improved and patient said, doctor, I am feeling bit better than last time. Now you see to it. Then we again ask AFP, that also shown a good action like 350. So here now what we did in the last, we did that borax Q is given for what purpose? To reduce the hepatic loading and reduce toxic accumulation from the tumor metabolism with the liver cirrhosis, right? Now here what is important in this case, we need to shift the organ support, like now we need to give the cardasmer. Because once we done the drainage, now we need to give support, that is called as a strengthening. So here we given cardasmer Q and carcinosin 204 pills once weekly. In the follow-up, like we again, what is important, always we see the values. Now sometimes we also need to see the whether that tumor is getting down or not, or whether it is some other liver lesions we are getting suspected. So we get the sonography done also. Here we get to know, like it convert from the 3.1 centimeter to 2.7 centimeter, which was quite, patient also got happy. Okay, doctor, the values are also going well and I am also feeling better. And if you look at AFP also got 280. But many time what happens, what we think na, in homeopathy, is it really happen? Because being a physician or being that patient, they usually know na, because what they have experienced in CS together, homeopathy always takes a time. But is it true? If you really ask me, no. But many times na, we need to start believe, we need to think accordingly. If we look at into, as we have seen many times, Biju sir told us like X-ray to be given for the during the dengue, and that helps us. Within a 3 days, we seen the platelet like 60,000 got to the 1,50,000. Biju sir shown that hepatitis B, how that R side 3x work, like on unique area tomentosa. Also, we have seen that all result. Now, after all these experiences, that day I came to know when I visited Biju sir like 10 years before. That day I got that experience कि homeopathy is far better and more stronger and more effective, and we can definitely look at it through the report as well. After meeting Biju sir, I have started doing that all investigation in detail. Genuinely speaking, I am greatly thankful to Dr. Biju sir. And yes, so let's proceed. In this time, again, as I told, that hepatitis B nosode is important. What happens many times, we give the intercurrent like nosodes, but what we did now, we give initially or we give in between, but we don't give continuously by the break. Because why it is important, that should not, body should not go at back state, so we need to keep always focus on it. So this is how we proceed. Now in the fourth follow-up, significant improvement was there. LFT got nearly normal, which was like 150 and 140 and all, and AFP comes to 210. So here we change the tincture, Hydrastis Q. That is given 10 drop BD, anti-inflammatory action. Now maybe doctors, you have the doubt, okay, doctor, every month you are changing mother tincture. Any specific reason behind that? Yes. See, what the state of that patient is, that we need to check. When drainage require, when support require, when that mucous membrane need a support, when that organ may be in the irritated phase, when that time we need to change. Because what I came to know is now, if we give the like Hydrastis Q for 3 months, it will stop acting on it, because that role is been complete already, because it's a supportive medicine. So this is how. Now we get the MR done like after 5 months maybe. So 2.7 to 1.9 centimeter we get, and liver texture even improve. So the Cifilinum 204 pills is given, and here what we gave this Myristica. Why Cifilinum is given? To address the central destructive miasm. See doctors, as we seen, as the time progresses, reports are getting normal and patient is also improving well. Here we need to break that terrain. At the end, like we need to give the Cifilinum, because after all we need to address that central destructive miasm is very important. Second, here we give the Myristica Q. Why? If you just check, you'll get the research paper which indicate it suppress HCC cells proliferation, induce apoptosis, inhibit migration and invasion, and downregulate the pathway like PI3K, AKT and mTOR that promote the cancer growth. Means it is not only helping to suppress, but it is also helping to downregulate that pathway also, which is actually causing that HCC. So this is how is important. Our masters already given these medicines in 200 years before. Now modern peoples are trying to analyze what is there in it. But what happens now? We only read Myristica, infection, inflammation, pus, give. But we never considered into this kind of cases. I'm not saying everybody does, I'm just sharing my thoughts. Now, next. So, after that, we get to know that AFP got shifted directly to 10 to 160. So, we didn't change anything, only we said have the extra salad. Because many times, na, patient, if we say na same diet, then they feel irritable. That time you need to keep some weapon at your side also. So then we ask you add more soups and add more salad, and better have the more raw food, fruits, so that he also feel better. Now after a year of MRI, we get that lesion which started from the 2.7 that comes to 1.3, and AFP got 120. Here we again give hepatitis B nozzle. But if you see to it now, we are given in increasing potency, like 30 started in between 3 months, 200 after 3 month, again means after total 6 months we increased like 1 m. Here we gave the Cardus mercu. Now why Cardus mercu? See, jaundice got improved, SGPT, SGOT got improved, APs got downside. Now what is important? Now need to strengthen the organ. That is a hepatoprotective and antioxidant property kind of medicine is to be given. So here we chosen the Cardasmar. That is again 10 drop BD. In the 8th follow-up, we get the patient is quite asymptomatic and patient says, doctor, I am really feeling very positive and I can feel to have food and I am not feeling that much stress. Initially, as I told you, because why I remember this case, that change because after 8 months, he came up with his family. And I was seeing that all the people like his, wife and all, those are saying, "Okay, doctor, we completely actually lost a hope." But the way the things are going on, it's really amazing. That is why I remember this case. Then, as the time that AFP got 85, carcinosin 200 again repeated, because as we know, this is a cyclical process. So it is going to, we need to see, because carcinosin is his own constitutional medicine, even though looking like an intercurrent. But whenever we give the constitutional medicine, we should not look whether that is a carcinosin is coming up or whatever the medicine is coming up. We need that case is required, so it is a constitutional for that case. Now after that we stop all the medicine for 2 weeks and we ask him to, you just rest, let's see how it goes. But here what we did is we gave the SL to that patient, because many times that is also going to affect that patient thought ki why doctor is not given me the medicine. But yes, that is a resting phase. Now in the 9th follow-up we check the again MRI that almost that 1.3 got to the 0.9, nearly in the regression phase. AFP got 60. Here we gave Scrofuluria Q. Now why Scrofuluria Q? You can definitely check the paper. It's an anti-tumor tincture or herb. So it is a anti-tumor as well as organ support. So here we gave Scrofuluria. See, if you see to it well, we are looking hepatoprotective, even though hepatosupportive, even though it should be have the anti-tumoral abilities into that organ support. It means that is really important that we need to care from back end always. Still the patient is doing well, still we need to keep it continue, because yes, constitutional is there to care, but we need a support likewise. Now patient is fully active, going well, AFP come to 40, livers becomes the normal, lesion got 0.8. Now consider here is a now which is showing scar. What is scar? Now no, not lesion is not looking, but looking like a scar, like how we get after going acne we get the scar likewise. Now here what we consider is a remission stage is no active growth, right? Now if we see the parameters, like how the modern people do the flowchart, that is how we did it. You can see the viral marker, symptom, miasm, tumor size, AFP, and how it works well, and how the condition stabilize with the carcinosin is very important, because as we know, master says, from the disease where we started with the constitutional, again at the end we need to give, that is for the closing the case. Now what is our homeopathic interaction, doctors? So I would like to explain you this how I have seen. So you'll get all the dots connected with it. Like one is viral past, that is called as a psychotic miasm activation. Second, HBV, EBV cause chronic inflammation. In homeopathy, what we call as immune suppression. Now if we talk about the terrain breakdown, means what? that syphilitic mutation because of immune suppression which has been there, that we need to treat by liver cell undergone the malignant transformation. So this is what. Now, which medicine which helps to reverse that terrain? Carcinosin, which corrected the cancer diathesis. Thuja, hepatitis nosodes, clear the viral imprints. Cardus, which helps for the liver drainage. Syphilinum, which helps to reduce destructive miasm. Now, just a moment. Before going ahead, I just would like to ask one thing. Hope you are getting how I am treating the case, right? Please raise the thumb so that we can proceed ahead. Yes, done. So what is important is, now you'll say, doctor, you told us about this, how you treated this case, but any other medicine which can support for that HCC? Yes, there is a one drug, cholestyrinum. This is a homeopathic treatment for cancer, have included cholestyrinum as one of the several medicines used for supportive care at managing symptom, improving quality of life, and address related ailments like abnormal liver function and cholestasis. See, this also medicine you can use as a supportive. Now, any other medication can you use? Yes, why not? One is Boldo, because we usually look it into for the purpose of gallbladder, but if we look now, it have the ability of anti-tumor potential because it contain boldine, which is for the cancer cells. Glyceralgia glabra, we usually heard this, but very rarely people use it. That is a glyceralgin, which is shown the anti-tumor activity in various studies, which have the cytotoxic effect as well as apoptosis marked. In composition of the cardamom, antioxidant because it contains silmarin. So it is an immunomodulatory, anti-proliferative, anti-fibrotic, even the promote the apoptosis antiviral activities. Now, any other tissue salt than given? Yes, natrum phos, because natrum phos is helps to reduce that acidic terrain. If you check now on boric, it is given the lactic acid increase. What is that? It is a acidic terrain. So this is going to help us to improve it, and in cachexic condition, like person is getting thinner because of that all acidic nature in the body. Even though natrum phos support the liver metabolic side than the structural side. Now, natrum sulp matches the toxic psychotic terrain. Hepatocellular carcinoma, what actually happens? Which actually compress the bile duct. That is why the bilirubin got high. Then natrum sulp to relieve biliary stasis. Natrum sulp supports sulfur-driven detox pathway, lymphatic clearance, reduction of metabolic waste, and improve general vitality. See, as we need to know the clear-cut disease pathology from where it started and where it landed, the same way we also need to know the deeper knowledge with that medicine which we are going to plan for that case. Like if you look in modern science, what they do, they use, this is the parameter, like worldwide, that number is IC, A given is ICD, this is the number. So they find that number, they'll write it into, they get all the chemotherapy which is suitable for that ICT, and they treat. Likewise also we need to have that clarity. Just as this is what I'm just trying to explain you, how I have reached up to that level. Now, and again I need to tell you something, whenever you get the time, just check one thing on internet. Bitis is a snake, right? You need to just check, write the name and write the word apoptosis of shell. You'll get to know, this drug have the apoptosis. Means our master already explained all that in the past, this medicine already have the anti-cancerous clinical ability to look it into. But many times we only read the Mater Medica. But I feel we need to check every drug in all the aspects, so it will be helpful to us to treat the proper way to our all patients, so that can bring the happiness in their life also. Hope you guys are there with me. Hope I'm not making you guys bore or not something.
I think so. The one of the participant has already suggested when you are showing tantrum pause. One of the participant has suggested that there is a remedy called as tantrum sun. So I think so. They are active. One
Oh,
of the participant has asked that what about calming? Why didn't you think about calming? Or why was not calming discussed anything?
because see, what is important na, in the case, we always need to check whether that is on that moment it is going to suit with that drug, that case. Okay, so this is what we observe for this case, because we have treated many cases. There we get to know कि if we give the calmic in between na, it may affect the going pathway. I'm not saying it is not useful, but yes, there are the many factors where we can use that one. So because in chronic liver failure, like cirrhosis of liver, fatty degeneration of liver, sluggish poor circulation, here these are the condition. Here we are using this all the stuff. But yes, this is a what? Hepatocellular carcinoma is not curative into that tearing acting drug. So that is why we have not used for the calmic.
So one more question so that we can go forward because we are at the last point of this session today. So
Okay.
8:57. So why are tissue salts given only in first prescription, sir? One of the question was that.
Because see, these are the supportive medicines, so which we already keep it continue. Okay, so that is not been repeated continuously into the slide, but yes, we kept continue whole prescription, because as I said, these are the supportive medicines which we given. It is definitely, it is not written in every prescription, but they are there with it continuously.
So it's given in every prescription.
Yeah.
It's only not written here.
But it is given in each and every prescription.
That's why. Okay. So
I just wanted to ask two things, Dr. Libin, just a second. Uh, Doctors, this is how we treat a case. Now I have very few questions to ask, very quick questions. Is it okay, Dr. Libin, if I ask?
yeah. Sure.
So, if science says it's a latent virus integrates into the host of DNA, so what do you think? What the word is used in the homeopathy for this, or what terminology is being used? Again, I'll repeat the question. If it is a latent virus integrate into the host DNA, what had our master said it years back? Like what is been said?
Dr. Subin has answered it's multi-miasm.
Multimerism. Now,
Then doctor has answered that it's latent sora.
correct. Wow, many answers are there. Great. I am happy to see. But it is called as, if you ask me guys, homeopathy, it is called as a dormant miasm. Okay, because it's a latent viral integrate into the host DNA. Means it is already entered into the DNA. So what will it cause? It will cause a dormant miasm. Now that can be also the sora, that can be also the psychosis, that can be syphilis, but we are looking for that term what they are used. Now again a quick question, what is immunology calls continuous immune irritation? What had our master said it years back, like what is immunology calls continuous immune irritation? In homeopathy, if we need to see this terminology, continuous immune irritation, what will be it is called as?
First answer was suppression.
Okay, great. Susceptibility.
One of the answers, I think so it's susceptibility someone has said, maintaining cause, one of the answers is that.
So, doctors, it's called as a continuous immune irritation, is called as a chronic dynamic imbalance. Now, we visit physicians like oncologists. What they say is it's a DNA damage caused mutation. Then what we'll say in homeopathy? So it will be called as a syphilis loss of form. Okay. Now, last but very important question I just would like to ask. How many of you says कि vaccination is important? And how many says vaccination is not important, it should not be given? Those says should be given, and how many says not to be given? Anything?
So put a thumbs up for should be given and put the thumbs down for
Not given. Right. Very perfect. Okay. Very good. Superb. Great going. So here what I can find is most of there are in favor of not given, and many of them are there with the need to be given. But if you ask me my own perspective in the terms of homeopathic physician, I personally believe that vaccination may not always be necessary for everyone. Now why? My concern is that whenever the immune system is artificially stimulated, it can influence the individual's terrain and potentially create epigenetic shifts. In someone with weaker vital force, this stimulate may act like an external morbic influence, possibly disturbing the inner balance or awakening latent susceptibilities, what we describe as a miasmatic tendencies. मतलब अगर सोए हुए शेर को जगाने का कोई फायदा नहीं है, because if the body is weaker and if it is being given, it may trigger if that influence the terrain and that may affect that epigenetic shift. Therefore, rather relying solely on external immune trigger, I prefer to focus on strengthening the vital force, improving the overall terrain through the homeopathic principles. In my understanding, long-term health depend more on restoring internal harmony than the external interventions. This is my answer to you all guys. And before saying goodbye, I just wanted to ask very last and quick question. Now, if you really understand how we treat a case, and if you really wish to understand the theory or the concept, like what is doctor called as a terrain, what is called as the epigenetics, what terms are used in homeopathy, what terms are used in modern science, is do we have the any terminology we can able to collaborate, how you understand that all that is given in homeopathy, that is the word which is used in modern science, we can definitely have the second session if you say so, or else if you say ki it's good for whatever happened today, then it's fine. Because to what I feel, to only show the case is very important to understand whether what the method I'm using, whether it is helping or not. Now you get the case, you understand how we did that all. Now you really ready to learn that process, I can teach in the next session, because so I can request Dr. Biju sir and the team to have the another session. So please write on the inbox, and as per your reply, if I get an opportunity, I'll definitely come to see you again.
So it's a overwhelming response. All of the participants are going for one more session. So I'm just texting the host.
Now
So,
here I just
based
wanted
on the
to
host, so we have decided we will do one more session on Wednesday. So it would be okay for Shailesh sir. Then we will do a same same time on Wednesday, we will do the session for Dr. Shailesh.
Now, just wanted to ask a very last and important thing. There we are going to discuss the theory part you are guys are looking for or the cases. Because what I know na, whenever I visit all over India physicians, many of the doctors allow me to meet. I just go with my open brain, an empty brain, and I'm just saying, doctor, I am a student of homeopathy. Please allow me to sit at your place. If you help me, it will be I'll be grateful to you. Why? I'll tell you, my dear doctors, we need to respect everyone's thoughts, and what I learned from that, we need to understand how they solve the case. Medicine is what given we can get everywhere, but if we know the process, we can treat any case of it. So process is always important. If we know the map, we can reach at in a day or in a night. But if we don't know the map, there is a very less chance to reach at that place. So you decide what you guys are expecting. Theory part, if you say I'm ready for it, if you say cases, again I'm ready for it. So Dr. Lipin,
Most of the reply are case and with theory, and lot of has requested the theory case part again and again with theory. So based on their response, I think so. They are all are saying both. So so you understand the public, na?
yes, yes, yes. Now,
This is the public that we are so proud of.
yes,
Homeocan is so proud of that. They love the both of the things integrated. So
yes.
they want to leave the practical with theory.
Of course. Then what we'll do, I'll just definitely come back with what you said, guys. And really, thank you so much. And really appreciate your efforts. And I am a part of Sakya. So I'm really feel nice. And I'm really happy to have you guys. Because see, I always say, instead of saying, I will grow, I always say, we will grow together. Because to learn and teach and explain, because our all masters written their books and keep it for us to share, for to sharing the knowledge. So anytime, every time, anything, please definitely contact Dr. Shailesh Sancheti. The best possible, I'll definitely help.
So thank you so much, Dr. Shailesh. I think so. It was a very wonderful and very insightful session, integrating a very less known thing as virus can cause a cancer, and how knowing that we can reduce the thing. So as Vijay sir has told us, we will decide the date and let you know.
Of
Until
course.
then, be active with the group, and if you have any queries, just pin your queries in the group. So thank you so much, sir, for this wonderful session. Um, so thank you everyone for being the part till 9 as we have exceeded the time 10 minutes from the time. So sorry for that. So thank you all. Thank you our patrons. Thank you Team Satya for letting me host this, and thank you Shailesh sir for doing a wonderful session. And we will see you in next session.
Of course. Thank you.
So this session is going to be ended. I think so. Dr. Akhil, should we are ending this session?
Recording stopped.
Thank you so much.